What can be a chronic life-changing disease that was once thought to impact middle-aged adults is now showing up more frequently in children. We're talking about kidney disease and disorders associated with it. Joining me right now from Yale-New Haven Children's Hospital are Dr. Adam Hittelman, and a pediatric urologist, and Dr. Davood Moutat, a pediatric nephrologist at Yale-New Haven Children's Hospital. Gentlemen, thank you so much for coming in.
Thank you.
It's wonderful that you're right down the street and you're able to stop over. Tell us a little bit. I mean, kidney stones was always something that I envisioned. I had friends that went through all that, but with children, what's going on? How did this whole thing come about?
Yeah, we're seeing it the more increased frequency. I think a lot of people always expect it to be occurring in adults, and I think as adults we think about it more often. But the incidence, the presence we see it in children more is really occurring a lot more often. And whether it's due to the changing diet, I think we are using a lot more fast food. I won't lie, typically I feed my kids whatever they're willing to eat, which often is the things that we think put us at risk for some of these metabolic problems, or whether or not there's a change in our diagnosis standards or other ways of identifying it. We're seeing a lot more with increased frequency.
Now, doctor, at what age are we starting to see this?
We can see kidney stones pretty much at any age. Some of the children who are born premature with either born with congenital disorders, genetic disorders affecting their kidney, which can put them at risk of developing kidney stones. And as Dr. Hittelman mentioned, in adolescents who we started noticing more secondary likely to increase protein intake, animal protein intake, increased dietary salt intake that we think are contributing to development of kidney stones in children.
Now, just kidney stone 101, okay? What causes kidney stones? Where do they come from?
There's a lot of different causes for the stones. Some of it is metabolic. Either your body is absorbing too much of the salts that form stones. Some of it is that your kidneys are excreting or urinating out too much. A lot of it can be related to dehydration. Most of us don't drink enough. If you pour salt in water, eventually it's going to start to precipitate out. Pour more water and it'll go back into solution. So sometimes just by drinking enough, we can avoid some of these issues. We see in children, compared to adults, it's more of a metabolic issue. There can be other anatomic problems that put you at risk for it. But there's really multiple different causes, and that's why we've come together to kind of take on this multidisciplinary approach to manage kidney stones.
Well, what's a common complaint that a child will have and a parent should be listening for if they do have kidney stones?
Sometimes kids will present with flank pain. Some kids will present with blood in their urine. Yeah. You can come in with a lot of different abdominal symptoms. Sometimes, you'll hear one problem, and as you go through your diagnosis, they'll have abdominal pain or even scrotal pain in a boy. It can be masked by thinking something else actually turns out to be a stone in the kidney or in the ureter, the tube that connects the kidney to the bladder.
Well, give us an overall view of the stone program at Yale-New Haven Children's Hospital.
We have established a multidisciplinary clinic in order to provide the best care for these children. We have myself as a medical nephrologist and Dr. Hittelman as a surgical providing surgical care for these children, as well as we have a radiologist, nutritionist, geneticist, and endocrinologist who also participate in the care of these children because many of these children can have problems with either endocrine or genetic problems as well that can put them at risk of developing stones.
But it's how you really work with the kids over there, and the sense of humor and the way you approach the children that I think is so wonderful. Yeah. Just real quick before we go, one quick story about a child that went in there scared, a kidney stone situation, and the way he felt when he came out.
I think anytime you go to the hospital, and we've all felt this who've had family or ourselves going to the hospital, it's a terrifying experience. And I think that the Children's Hospital, Yale-New Haven Children's Hospital, does an excellent job in approaching the children, approaching the family, which are as invested in the care as the children are. We have, besides the team of physicians and nurses, we have child life specialists. So without giving you just a specific case, I think it's just our overall approach to the management of children is what makes the difference. And then there's the multidisciplinary team that sees you before and after. From my side, the surgical approach. Then you also have the medical management. You have the brains behind the operation and the plumber who fixes it from the surgical standpoint. And we come together with all these other team members and really, I think, provide excellent care.
It's a team approach, and the kids feel, the kids are just treated so well over there. Yale-New Haven Children's Hospital. Unbelievable. If you'd like more information, give them a telephone call. There's the information on the screen, 203-785 4081, or just go to ynhch.org. Thank you so much, doctors, for coming in. I really appreciate it. Going to hang around for some pulled chicken, I hope, okay?